U.S. has already had nearly 500 cases of measles this year. That's a lot more than last year, and it's not even April. Omar Villafranca spoke with a mom in Texas trying to protect her newborns who, like millions of others, are too young to be vaccinated.
Davery Hasso's 3-week-old twins, Ezra and Adriel, arrived in West Texas in the middle of the state's worst measles outbreak in decades.
How do you strike that balance of being probably hyper aware, but also trying to tell yourself, like, we're going to be okay?
It's hard. It is very hard. I try to keep myself calm and just like, hey, you know, if it happens, it happens.
But taking precautions.
100%. Taking a lot of precautions.
Adriel was born with breathing issues, so Hasso's trying to stay especially careful.
I do have concerns as far as going out in public or doing certain things.
Typically, the first dose of the measles, mumps, rubella vaccine is given to babies 12 to 15 months old. Then, a second dose is given between 4 to 6 years of age. But now, in a recent article in the Journal of the American Medical Association, former CDC Director Rochelle Walensky is recommending federal changes to add an extra dose for kids as early as 6 months, if they're living in or plan to travel to a measles outbreak area.
We have generally between 2 and 4 patients in the hospital each day with measles.
Dr. Laura Johnson is the chief medical officer at Covenant Health in Lubbock, on the front line of the West Texas outbreak.
Is there any concern moving it up to 6 months? Parents may wonder, hey, is this safe for the kid at 6 months?
Sure, yeah. It is, there really aren't any significant concerns with that.
It is something that I would consider just for the safety of my kids, really.
For Hasso, it's peace of mind in an ongoing outbreak.
Omar Villafranca, CBS News, Lubbock, Texas.
Doctors say the MMR vaccine, by the way, very effective for prevention. 1 dose is 93% effective, 2 doses, 97% effective.